Most people assume that thyroid problems are related to their fatigue, hair loss, or mood swings. But I don't hear doctors talking much about parathyroid glands that can play a hidden role and have very similar or same symptoms. Many doctors overlook the parathyroid glands because they think their issues are less common. But addressing these glands or testing to see if there are any abnormalities can be the answer you're looking for when it comes to better energy, brain clarity, or just overall feeling like yourself. So what are parathyroid glands and what are they responsible for? They are 4 tiny glands located behind thyroid in your neck. Now, despite their name, they have nothing to do with thyroid function. They are completely separate. Parathyroid glands produce PTH, which is parathyroid hormone, which balances calcium and phosphorus in the body. Now, calcium isn't just about the bones, although that's what you hear the most. It impacts muscle contractions, nerve signaling, and even heart function. So here's why that matters. A malfunctioning parathyroid glands can mimic a thyroid issue, just like fatigue, brain fog, or even weight changes, which makes it easier to be misdiagnosed. Now let's talk about the symptoms of parathyroid problems. Similar to thyroid, but again unrelated to it, when parathyroid glands malfunction, they can either be overactive, which is hyperparathyroidism, or underactive, which is hypoparathyroidism, which leads to distinct sets of symptoms. Let's start with symptoms of hyperthyroidism, when it's overacting. Fatigue and low energy, which again is similar to thyroid, but it doesn't have to be thyroid issue. Muscle weakness, especially in proximal muscles, which makes it harder to function every day. Bone and joint pain. If you're having aches or pains in joints, this can also lead to osteoporosis. Kidney stones. Those notoriously painful kidney stones can be formed because of too much calcium in the body, or I should say in the blood. Excessive urination, which again, if not managed, can lead to dehydration. Abdominal pain. This can sometimes be accompanied with nausea or even loss of appetite. Depression and anxiety, which again, you can relate to so many other things, but it could be a symptom of this. Constipation, like if you're having trouble going to the bathroom, or if you don't go daily to the bathroom, that's always a red flag. Heartburn, GERD. This can be called acid reflux or heartburn symptoms. And again, you may be thinking, oh, it's something that I ate, but if it's new, if it's chronic, if it's consistent, it's worth checking into. Insomnia, having trouble falling asleep or staying asleep, which again leads to that overall fatigue, and it becomes this catch-22. You are resting, you feel like you should be rested, but you feel more and more fatigue. Now, let's get into symptoms of hypoparathyroidism when it's underactive. Tingling sensation, tingling or numbness, especially in hands, fingers, and around mouth. Muscle cramps and spasms that are obviously involuntary, they're often referred to as tetany. They can be contractions, cramps, or spasms. Brittle nails and hair loss. If you're noticing changes in your nails or hair, this can also be a symptom of hypoparathyroidism. Dry skin, I should say any skin changes in general are red flags from the body, but in this particular case, skin becomes dry, coarse, and even scaly. Mood changes, such as feeling more anxiety or depression and not understanding why and where it's coming from. Memory issues, difficulty remembering things, difficulty concentrating, difficulty focusing, and even seizures in severe cases where calcium is so low that it leads to seizures. Now, it's important to note that these conditions can very easily overlap conditions from something else, which is why I urge you to always consult a healthcare professional who can create accurate diagnosis. And of course, sometimes you may need to push for some tests. So here's what to check and what to do. If you suspect any parathyroid issues, ask your doctor to check blood tests for calcium, PTH levels, and vitamin D levels. Sometimes imaging like ultrasound or a scan can be used to spot the abnormalities in the glands. And what you can do on your own is keep an eye on consistent or persistent symptoms, especially if they're not improving with thyroid treatment. Or if any of the things that I have listed, you have noticed that you have been having issue with lately, maybe you've been going to the doctor and getting dismissed, maybe you haven't even checked for them because you thought they're maybe not a big deal, it's worth testing those levels to know if there are any underlying issues. Here are natural ways that you can take care of your parathyroid glands. in their health. You want to eat more calcium-rich foods. Things like dark, leafy veggies like kale and spinach, almonds, sesame seeds. They can all help maintain healthy levels of calcium in the body. Now, one note when it comes to nutrition is diversity. You don't want to now attack spinach and have it every single day. You want to diversify because you don't want anything from that particular plant to start building up in your body. Second, vitamin D. You have to get sun exposure without any sun protection creams for minimum of 20 minutes a day, which means in fall and winter, if you're not getting enough sun, or if you're just not getting 20 minutes a day without any SPF, you definitely want to supplement. Now, if you've watched any of my other videos, you know that I always talk about taking D3 with K2. You always have to take both together. If you're looking for a high quality supplement, I'll leave the links in the description to the one that I use and recommend. Next thing that you can do is pay attention to your magnesium intake. Things like nuts, seeds, avocados. They have magnesium, which supports calcium regulation, as well as bone health. Next thing you can do is stay hydrated, because staying hydrated supports kidney health, which is very closely related to calcium balance. You know we can't talk about health without talking about stress management, stress reduction, and then not having any stress. Chronic stress impacts all glands. Every cell of your body, actually. Therefore, it obviously attacks and influences parathyroid glands as well. This is where you want to incorporate meditation, deep breathing techniques, relaxation techniques, all the things that you can do to de-stress. Remember, we're designed for short-term stress, and then we're designed to go back to our normal. But if you're chronically stressed, you won't even notice it anymore because it becomes your normal. However, it's destroying your body. Other things you can do to make sure your parathyroid glands are functioning properly would be reducing processed foods that are high in phosphorus. Things like sodas or junk food. They can very easily throw off the calcium balance, and we know that they're destructive for the body. Next thing you want to do is maintain a balanced diet. Remember, I mentioned how you don't want to just jump on spinach and have spinach every day now, because you want to have different colors and different foods on different days. Make sure you're having adequate protein. Now, too little protein can affect calcium absorption. So make sure you have protein with every meal. And then avoid over-supplementing calcium without checking your proper levels, because too much calcium can strain your kidneys and actually worsen your symptoms. Is this the first time you're hearing about parathyroid glands? Have you experienced any of the symptoms that I listed consistently lately? Let me know in the comments. I'd love to hear from you. And then remember to check the description for resources and ways to work with me if you want more guidance of taking control of your health.